In 1984, Huntington Memorial Hospital created Huntington Senior Care Network, with the goal of offering an array of services designed to help our older and disabled adults maintain their independence. Huntington Senior Care Network has assisted countless families who are struggling to meet the challenges of keeping their older loved one at home.
Just the fact that I'm home has made quite a bit of difference. Being in the centers, they're nice. They treat me very well, but it's not like being home. Then I get to see my kids, my family. They come over once in a while, and that counts a lot for everything.
At Huntington Senior Care Network, we realize that many older adults are not accustomed to asking for help. They don't know how or where to reach out for the programs and services they need. Many of these people have loving families who want to assist, but simply do not know where to turn, or don't have the resources to provide help if they could find it.
My mom was in a long-term care facility, and while her care was good, her sense of survival was not there. And we would visit her, and she would just be in her chair, sharing a room with another person, and she looked sad, and she was just in front of the TV, and I'm thinking, you know, our mother cannot exist the rest of her life like that. And everyone who saw her, it just broke our hearts to see her that way. So they said, what can we do? And we collectively put our heads together and said, we need to bring Mom home. The cost for care is really expensive, and we're not a wealthy family. And when you bring someone home who has specific needs, and you don't have the experience of knowing or having an understanding of knowing what this person needs, you come home and you have to figure it out, and there's this huge checklist.
Well, when we barely took her out of the convalescent home and she was really sick, she had pneumonia. We called the doctor. The doctor never called us back, never gave us any medication. We didn't know how to transport her to the hospital. That was the lowest point, to see that she couldn't breathe, that she was very sick. We didn't know who to call. She didn't have a walker. She didn't have anything so aside from herself. Once we got a hold of Senior Network, that started us off.
To best help a family access the services they need, Huntington Senior Care Network can develop a team with one of their social workers or nurses and the client and their caregivers. Together, this team will design a plan that best addresses the unique needs of the family. This team will become someone the client gets to know and can trust, who can be depended on to understand their particular situation.
The first visit usually starts with either the social worker or the nurse. Myself being a nurse, when I come out, there's paperwork and things that they have to sign. We explain to them about the program, what happens every month when we either talk to them or come out to visit, and then we go into their health and start out with, you know, surgeries they've had. Diagnoses are, go through all the systems, check about, you know, their eyes. When was the last time they saw an eye doctor? Some people haven't seen a doctor for a long time in regards to that. So we would be looking at how we could get that to happen more frequently. Their teeth, all those different kinds of things. And we look at all the medications, make sure that everything they have is current and not expired. We usually check to make sure pathways are clear, rugs on the floor, throw rugs particularly, because those can be a hazard for someone to trip. Then we'll go into their bathroom and check for safety equipment, if they could use grab bars by the toilet, in the shower.
After assessing the situation, the team will then make recommendations for solving problems and reducing healthcare risks.
When they came out, Mom was evaluated with a social worker, and the manager came back with a care plan based on her specific needs. They identified what her needs were, talked to the family, found out what the family dynamics were, and what our needs were collectively to make this a go.
Together with the client, Senior Care Network develops an individualized care plan involving the family, doctors, and appropriate agencies. They will then find the programs and services that are needed, fill out the paperwork, and arrange to get the services to the client. Once the program is in place, the team stays with the client to monitor their progress and the quality of their care and to provide further assistance when necessary. The first step is to give Huntington Senior Care Network a call.
And most times it's not the client who is the one who makes that call. It's a neighbor who lives next door who sees that somebody is failing a bit. It's a family member where the client has had several falls, or they're just having trouble with their activities of daily living and need more help.
My mom was completely independent before this occurred. Now she's completely dependent. Staying home is really important to us for our mother. And Huntington Senior Care does everything that they can within their power to advocate for us and to try find funding for us so that we can accomplish that goal for our mom.
Being home is important to her because she gets to laugh, she gets to fight, she gets to just be part of the world again. So all that has really changed dramatically her health. Right now she's much healthier than she was at the convalescent home. She's a much happier person.
Sometimes people are concerned that asking for help will lead to unwelcome changes in their lifestyle.
They hear, a social worker coming in or a nurse coming in, and that, they're going to come in and think that they're going to say, okay, you really need to go to a facility or you need to go to a skilled nursing facility. The whole point of the program is to keep the person at home as long as they're able to stay there safely. So, and that's the key word, is safely.
For us, it's been very helpful. They don't get in your business. They don't come and tell you how you have to live your life, how you have to treat the person. They just help you, give you a better quality of life for your loved one.
It is easy to feel alone or frustrated when faced with these challenges. Whether one is an older adult living by herself or a family trying to care for a loved one on their own, please know that the professionals at Huntington Senior Care Network are here to help. With their years of experience in care coordination, they can make it easy to access the programs and services our community needs and deserves. Here at Huntington Senior Care Network, we look forward to working with you.